Hi there, my name is Martin Stone from Switch On Health, and I'm very happy today to be joined by Virginia Baker in New South Wales, who is our latest graduate in Western Herbal Medicine. So, Virginia, first of all, congratulations.
Thank you, Martin.
How's it feel?
A relief. It's been a long time coming. Yeah, which
Yeah,
is one of the
yeah.
goods and bad things about self-paced learning, isn't it?
Yeah, it sure is. I was actually having
Mm.
this chat with somebody the other day, and there's, I guess there's pros and cons to different types of delivery. The way the way some colleges will deliver is that they'll have set intakes, and everybody's sort of moving together as a group, which is fantastic for progression. But of course, it means you're kind of locked into that
You
schedule.
are locked in.
And
Yeah.
yeah, what we decided to do obviously was offer that flexibility, which is what we hear is really important to people.
That was
But of
one of
course,
the
the drawback
things.
is,
Yeah. But the flexibility was one of the things that appealed to me in the first place because when I first started this course, I had two businesses operating, a home, two Airbnbs, and juggling a lot of things in the air at the time. So it was something that had to fit in with me.
yeah, absolutely. And so it worked for you.
It did, yes. Yeah.
Yeah, fantastic. So, look, Virginia, you've obviously you came to us for a lot of RPLs. You've been in the industry for a long time, I
35
think.
years.
So, look, I guess first of all, this is a question with two parts. So, I suppose first of all, do you tell us a little bit about your background,
Yeah,
in natural health industry,
yeah,
and then of course the second part to that is, where did your studies with Switch On Health tie into that? What led you to start
yeah,
studying with us?
yeah. It's been a little bit of a progression. So I initially studied pharmacy, which I graduated in the late 80s. I worked for other pharmacists for a few years. I've worked in hospitals in London, done a lot of different things with pharmacy. I own my own garden variety pharmacy, for want of a better word, for 22 years. During that time, I started doing home medication reviews, which gave me more of an insight into the slower way of dealing with patients rather than the usual way of everything being very reactive. People coming in saying, got a sore throat, what do you want? Here it is. Whereas natural medicine's more like getting to know why they've got the sore throat, for a little bit of an analogy. Um, During the time that I had my pharmacy, I employed herbalists and naturopaths. So I sort of got to see what they were doing. And they invited me along to a lot of their continuing education things with them, which I enjoyed a lot. About 15 years ago, a bit more, I started doing compounded pharmaceutical medications. When I started doing that, people assumed I knew more about natural medicine than I actually did. And I can't really fake it. So I went out and got a certification in anti-aging medicine, which was more of a functional medicine based, and it was the model you spoke about before. It was 2-year course with blocks of study at home and then a week in different cities around Australia, which was very interesting. So that got me a little bit more of a taste of natural medicine at the same time. Another thing that led me down this path was with the compounding. I did a tour of America and they went to compounding pharmacies. And one of the pharmacies I went into had more of a herbal medicine base. And they had echinacea on tap and they were giving it to people as an echinacea shot, like in a pub. So it was very different to the way we do things, but it was a little bit of an insight. Um, then I sold my pharmacy and went into purely doing compounding and some functional medicine consultations on the side type of thing. And I found that I had a 6-week wait for appointments, and the compounding was bringing the money in, but it was keeping me away from what I was more passionate about. So I decided to get some official qualifications in natural medicine, which led me to you.
Um, I'm intrigued. What else is different about the States compared to Australia?
Well, they had dogs in the pharmacy to start with, so that was very different. The conference I went to in the States, uh, they looked more at the whole person than we do. Like they mentioned a lot more spiritual component to people's healthcare. So a little bit of an insight there. Getting on to what's different, this is another reason why I've gone down a more of a herbal medicine, natural health role. A few years ago, I went to Italy, and my daughter had been a student there, and we went to stay with the family. We went to visit the grandma, and she had her medications on the side table. So, being a pharmacist, I had a little bit of a sticky beak, and they were exactly the same drugs as she would be prescribed in Australia. And I thought, there's something wrong here. Things are not personal enough.
Yeah, right. I think a lot of people, I think, would probably understand that within the boundaries of Australia, but
Yeah.
I guess to recognise that it's
It's a
actually
worldwide, well,
global.
they've got
Yeah,
worldwide medicine, really.
yeah.
It's a bit of an
Pharmacy,
insight.
pharmaceuticals, big business, huh?
Yeah, yeah.
Massive business.
But at the
Yeah,
same time, I'm not anti-pharmacy or anti-medicines. It's got its time and its place. Very good at acute problems, but not so great at lifestyle problems.
yeah. And as you said, not treating the person, not offering a personalised approach, not really looking at what's going on with that particular person, but just okay, you've
It's
got
all too
X
quick.
condition.
Yeah,
Yeah,
yeah, which
yeah.
is an endemic problem, I think.
Yeah, yeah, I'm
Mm.
sure. And the functional medicine course that you did, so I'm assuming that's really kind of tailored more for those who are working in mainstream medicine and
It
who are
was
interested in complementary medicine.
it was a bit of both. There was myself, a newly graduated naturopath, a biochemist, an integrative dentist, and a couple of integrative GPs. It was a very interesting group of people. Yeah, and we were with the same group of people for 2 years, so I've kept in contact with a few of them. So it's been good. Mm.
Fantastic.
But that got me
So
more
obviously,
into that got me more into testing, like genetic profiling and
right,
putting numbers on things. Whereas what you've given me is a little bit more personalized. Oh, more and
yeah,
less personalized. Different, different.
yeah. Okay, well, look, that was basically going to be my next question. I mean, obviously, you've had exposure to so many different aspects of the training within this really broad umbrella of complementary medicine. So what was different about Switch on Health? How did you find the experience of starting with Switch on Health?
Um, well, I found that the videos that you provided were all very interesting. It made things easier. Found that you could get personal help if you needed to. You could always ring up or email and get direction where to go. I found the recommended texts and resources really good. Like I can sit them on my coffee table and read them now again. Yeah, I think that the assessments were very long and you had to force yourself to do some of them, but it did reinforce the learning as well.
Okay, so a bit of a pro and a con to the assessments. Like maybe we could make them a bit more condensed, you think? But they did perform their task
I
in
think
terms of
that
assessing you.
they do perform their tasks, but I think some of it could probably go down to multiple choice, maybe.
Okay, yeah,
Maybe
yeah,
not all of it,
we've
but
done a
some
little bit
things.
of that.
Yeah.
Yeah,
It may have
yeah.
evolved
Okay,
since
great.
I started.
Sorry.
It may have evolved a little bit since I started too.
Yeah, well, look, it always is evolving. We're not ones to kind of produce curriculum and then sort of go, yep, that's it. We're always improving, always gathering that feedback, collating
Yeah.
all the feedback, looking for what changes can we make that are going to have the best impact. So, yeah, it is always evolving. Yeah.
Something that I would like to say was that doing something like the switched on health courses, it's the beginning. need to keep learning beyond that. And I'd encourage
Yeah,
people
and
to read. There's a webinar 2 or 3 times a week that people can jump in on.
yeah,
And it's very valuable to get yourself a mentor as well. Yeah, sometimes
wise
being
words.
in a complementary industry, a lot of people work independently or in a small clinic. I think it's very important that we have the community out there because different people are good at different things. None of us invented this, and the more knowledge we can share, the better.
Yeah, absolutely. I think also that we one of our strengths. We sort of touched on this earlier. That we treat each person uniquely, which is a
Mm.
definite benefit of the natural medicine approach. And I think a potential drawback of that approach is that um, some people do struggle because it's as if they kind of have to think about, it's
Everything.
like they're starting again with every single patient they've got. Whereas I guess in the medical approach, once you've kind of stuck somebody in a box and said, okay, this is what you got, it's very sort of automated the steps that are going to be followed, and there's much less thought involved. So I think that a lot of people find this a bit of a challenge. And yeah, I think that that's where sort of having a mentor and support network can help in
Mm.
terms of, okay, focus on this or try this. Yeah.
Yeah, yeah. And the support network doesn't have to be within herbal medicine. It can be having a good massage therapist to send people to, things like good
Yeah, good
food
point.
to go to.
Yeah, yeah, good point. Networking and
Yeah.
getting those cross referrals, great way
Mm.
to build your practice. Yeah. So, Virginia, what's next?
What's next? Well, one of the things that I've always had to say was I'm a pharmacist with an interest in herbs. Now I can say I'm a herbalist. So that's
Fantastic.
so that's
Love it.
something that's a bit different. Um, I'm seeing clients already, so I'd like to consolidate what I'm doing there and build on that. I'd like to get to the point where I can do more online business so that I can have opportunity to travel. In saying that, I do like to see people face to face as well. So a little bit of a hybrid model I'd like to develop. I'd like to develop more in my areas that I'm interested in, which are anti-aging, obviously, which doesn't mean Botox and things like that. It means inflammation, balancing hormones, nutrition, all that sort of thing. I've got a big interest in fertility, and there's a lot that herbal medicine can do around that. And mental health. I think mental health's something that always needs extra people involved.
Well, you're going to be busy,
I
Virginia, because
know.
there's a lot of mental health in this world. There's a lot of fertility issues. This
Yeah.
is,
And no one wants
we've
to get
seen an
old.
absolutely, yeah, we've seen a shocking increase in fertility issues for many, many reasons. And
Yeah.
yeah, aging population. So I think you picked pretty good
They,
segments
they
to
all
focus on.
they all tie in well together too, I think.
Yeah, they absolutely do. Well, look, Virginia, congratulations once again.
Thank you.
I know it's been a quite a long journey for you, and yeah, look, we've really loved having you with us on that journey. As I said on the phone the other day, you do get to keep that lifetime access to your subjects that you've
Which will
done
be
with
good.
us.
Yeah.
So yeah, when we do evolve, when we do make those improvements, they're always there for you.
Yeah. Yeah. Okay.
Excellent.
Thank
Well,
you for helping on the journey.
sorry,
I said thank you for helping me on the journey.
it's our pleasure. It's our honor, our privilege, really. So yeah, look, keep in touch, Virginia, and yeah, we really look forward to seeing you out there, changing the world and helping people.
Okay. Thank you, Martin.
Thanks, Virginia.